Hello, my name's Oliver Blocker and I'm the lead clinician for same-day emergency care in Betsy Cadwallader University Health Board. I'm here at Ysbyty Gwynedd in our same-day emergency care unit. Here in our same-day emergency care unit, we are treating ambulatory patients. An ambulatory patient is a patient who's safe to go home and sleep in their own bed, but still requires hospital treatment. In this special unit, on the hospital front door, we can provide this inpatient care which people can come to for one day or 2 or 3 days until their treatment is finished, and this avoids inpatient hospital admissions. In this collaborative workspace where all specialties can cooperate and work together, we are able to provide the diagnostics and decision making to allow people to be treated but not admitted to hospital. And the aim of this is to happen on the same day. We're able to provide therapies, wide-awake local anaesthetic, no tourniquet procedures, and we have the space and capacity to treat people as part of the general medical intake, the trauma and orthopaedic intake, and provide decisions and diagnostics for the general surgical intake. So although I think this patient who has a stable, non-complicated injury could be treated well in a walker boot, they could go home and we could do a virtual fracture clinic follow-up to make sure that they've recovered from their ankle fracture. We can do a electronic discharge summary to send to the GP, and I'll dictate a letter which can go to the patient to give them all the information they need on their expected recovery, rehabilitation, and any SOS return they might need if they have any problems, and they can call us here in the unit. Hi, Mrs. Hamilton Crossley.
Yeah. Perfect day.
My name's Oliver Blocker. I'm one of the orthopaedic consultants. You've broken your wrist. It's called the radius bone, and it's just next to your wrist. This is a very common injury. It's in a perfectly acceptable position with just treatment in that plaster. Yeah.
So I can just do 4 weeks.
Exactly. It's a stable, uncomplicated injury. You only need 4 weeks in the plaster. We'll get you back to our plastering where they can remove the plaster. I'll give you some information on self-directed physiotherapy. You don't actually need to see an orthopaedic surgeon again. What we do need to do is, because you're over 50 years old, this injury can be a sign of osteoporosis. So we do need to put you in touch with our osteoporosis services. I'll do your discharge summary now. Do you need any painkillers?
No.
Fine, good. So we'll give you some information and exercises and you should get better by yourself, and you should have a pain-free functioning wrist.